Please, I need someone to see my daughter. She can barely walk in a straight line. Her foot keeps dragging. She's bumping into things.
Please take a seat. As soon as I have a doctor
Denise,
available.
come over here, honey. Do you see what I mean? Oh my God.
Need some help over here!
We got her.
Mom,
Hi there.
I can't feel my leg.
Okay, I'm Dr. Halstead. We're gonna figure out why that is, all
Okay,
right?
thank you so much. She started complaining on the plane ride home from Australia. She said that her feet were tingling, that her legs hurt. I thought it was just from sitting so long.
Did Denise do any outdoor activities while you were there? Hiking, swimming?
No, no hiking. We picnicked a couple days.
Deep tendon reflexes are absent. Okay. I'm gonna ask you to close your eyes super tight for me, all right? No peeking. And when I tap you on the leg, will you point to which side I'm tapping on?
Yeah.
Normal sensation to light touch. All right, can you lift your legs for me now?
That's all I can do.
Okay. Let's get a CBC, CMP, ESR, UTOX, and a brain and spinal CT and MRI, and do a full body scan for rashes and insect bites, okay?
Is she paralyzed?
Let's not get ahead of ourselves, okay? While she is showing signs of paralysis, it's most likely temporary.
It's probably a nerve compression injury from the long flight. We're gonna run these tests and we'll take it from there.
We'll be back soon. All done. You were so brave.
Hey, Mom, we should have the results back within an hour or two.
I don't understand. You said her tests were normal,
They were.
but she's getting worse. She can't move her legs at all anymore.
We will have a much clearer picture once we receive the results back on Denise's cerebral spinal.
And we'll ask the lab to put a rush on these, okay?
Thank you.
Yeah.
Of course. Well, you saw that girl's CSF. It was crystal clear. The lab's not going to tell us anything we don't already know. There's obviously not encephalitis, meningitis, Guillain-Barré syndrome.
Oh, hold on. Let's not rule out GBS. It fits her clinical presentation almost to a T. I mean, normal blood work, ascending symmetrical paralysis, absent reflexes.
Let's just do one more round of labs first. Okay, test for heavy metal poisoning, exotic infection, and if we don't get anything from those, I'm all for treating it as GBS, okay?
My daughter, she can't breathe.
Okay.
Hey, Denise, look at me. Deep breaths for me, okay? In and out.
Can you squeeze my hand? Can you lift your arms for me?
What's happening?
The paralysis is moving up her spine.
Kind of a time of day 50 sucks we're intubating.
You're gonna put that down her throat?
Okay, why don't we give the doctor some
No,
room
please,
to work?
please, I want to stay with my daughter.
It's okay, we'll stay right here. Okay.
Couldn't do much of a neuro exam with her sedated and intubated, but if I had to guess, I'd say she's paralyzed.
Thanks, Sam.
Doing the hokey pokey there, Halstead?
Huh?
Your foot.
Oh, yeah, just fell asleep. Kind of banged it this
No,
morning.
never mind.
You're right. We should have started IVIG and plasma exchange way earlier. It was a mistake to wait.
No, you called it. I don't think it is GBS anymore. It's progressing too rapidly.
Nothing else it could be. I mean, GBS is the only thing on our differential that makes a modicum of sense.
When did ED doctors get so polite with each other? You two dating or something? Never mind. Start with IVIG and plasmapheresis. At this point, I'm ready to throw the kitchen sink at this thing. Page me when her sedation wears off.
You okay?
Yeah. Any improvement?
Denise's use functional grade is still at 5.
Is she triggering the vent?
No,
IVIG isn't working.
it's way too soon to know that. Give it some time.
I think we need to try immunosuppressant.
Are you okay? What happened?
I don't know. My foot went numb and just gave out. And I can't move my foot. Can't feel anything, Sam.
All right, press down on the gas pedal hard as you can.
Have you been ill at all recently? Is it possible you're immunocompromised? How about any interactions with the patient? Any needle sticks? Is there a chance you exchanged fluids somehow?
Only direct contact I had with the patient was when she collapsed. I carried her into the ED.
How about you? Are you experiencing any numbness or tingling in your lower extremities?
We haven't even established what Denise has yet, let alone if it's contagious.
Do you think it's a coincidence, your paralysis? Where are you with your differential?
We were operating under the hypothesis that she had Guillain-Barré syndrome.
Well, that's obviously a dead end. GBS isn't contagious.
I'm gonna get started on an LP.
Collect everything you've got thus far on the girl. Every test you gave her, you give him. See if we can find any patterns. Now, Dr. Manning.
These just came in from radiology.
Finally, thank you. Damn, I'm not seeing anything.
Why was Will getting a brain MRI? What's going on, Natalie? Is he okay?
Dr. Manning,
Yeah.
the pic you called. It's your patient Denise. They need you upstairs.
All of a sudden, I saw her leg move, and then she reached out for me.
Reflexes are all back to normal.
Denise, I'm gonna have you stand for me now, okay? It's great. All right, now I'm gonna have you walk to me, and I'm gonna let go, all right?
Okay.
Let's go. Sam, what am I missing?
Best guess some kind of toxin needed to work its way out of her system, but how that got to Will, I have no idea. I mean, contagion's one thing, but this is more like a game of tag.
Thank you, Dr. Manning.
Tag, now you're it.
Nat, what are you doing? You shouldn't
Just
be...
look at your MRI. You see that bump above your coronal suture?
Yeah?
First, I thought it was a mole, but...
What is it?
Ah, there it is.
There what is? Nat.
Gotcha.
Ow! Was that a tick?
Uh-huh.
Wait, is this Lyme disease?
Nope. Tick paralysis. The salivary gland produces a nerve toxin. This guy came all the way from Australia, courtesy of Denise. It must have detached from her scalp, but stayed in her hair, and when you picked her up, it attached to you.
But if it was off her by the time we got Denise into the ED, how come the paralysis kept moving up her body?
It typically worsens for a few hours once the tick is removed.
So I'm not out of the woods yet.
Nope. But the paralysis is mass dependent, so it shouldn't move as quickly up your body. But you still have to spend the night in the ICU. I gotta get this to serology. Don't move. When did Emma's pain start?
About an hour ago, halfway through ballet class. Wasn't sure if I should bring her in, but her mom would have my head if something happened to her. I was worried that it might be appendicitis.
No, appendicitis would be pain on her right side, but I would like to get an ultrasound. You know, when I was young, I wanted to take ballet, but unfortunately, I was born with 2 left feet, so I went with violin instead.
Well, I don't really like dance, but my mommy did ballet when she was young, so she makes me go.
All right, now I'm gonna put this on your stomach so I can see what's inside, okay? All right. Winnie, can you increase the depth? I can't see her uterus and ovaries.
It's already all the way up, Dr. Manning.
All right, let's start a line. Give her 1 milligram of morphine for the pain, and let me know as soon as her mom gets here. I'd like to speak with her.
Is Emma gonna be okay?
Yes, it's a good thing that you brought her in. All right, Emma, I'm gonna be back soon, okay?
Okay.
Thank you.
Thank you.
Hey, Dr. Charles, you got a sec? I've got a case I'd like to run by you.
What you got?
My patient, Emma, 9, she presented with abdominal pain on the left side. So I did a quick bedside scan to check her ovaries. It's actually testicular torsion.
Testicular torsion.
Yes. The ultrasound showed an absence of uterus and ovaries, but she has undescended testes.
Huh.
Nothing about this in her chart?
No, I doubt the family has any idea.
Okay. Page Pediatric Urology. We need to get a plan together.
Okay, thank you.
I suspect Emma has 17 beta HSD3 deficiency. It's caused by a genetic mutation. Emma's testes aren't able to carry out the final step of testosterone synthesis.
So, just to be clear, genetically, she's male.
She almost certainly has XY chromosomes, yes.
As far as the testicular torsion, what's required?
We need to untwist the testis and then fixate it via orchiopexy.
So we'll be able to save the testicle?
With surgery, yes. Otherwise, it'll die from lack of blood flow in 6, maybe 8 hours tops.
Okay, thank you, Dr. Rios. We'll share the news with her mother and get surgical consent. This news could change Emma's whole sense of identity. It is a lot for this family to process.
In my experience in situations like this is that the children are often surprisingly open-minded and resilient.
I don't understand. How could her doctors have missed this for so long?
Why don't we go somewhere more private? Your daughter is in excellent hands, trust me. Here, right this way.
So because Emma's genitals are typically female, there is no reason to suspect that she had the condition.
If the testicular torsion hadn't caused Emma's pain today, it's very likely she wouldn't have been diagnosed until she reached puberty.
What happens during puberty?
When Emma turns 12 or 13, the testes will start to make testosterone.
She may develop typically male attributes, body and facial hair, an Adam's apple, her voice may deepen.
What? No, that can't happen. You have to take them out.
The only thing that is medically necessary right now is to alleviate Emma's pain by untwisting the testis.
But Emma would have to have another surgery down the line, right? I mean, she'd have to have them taken out. She's a girl.
Children with Emma's condition often identify as male after puberty.
No, that's not going to happen. I want you to take them out.
To perform an irreversible procedure of this nature, we would need to inform Emma and get her assent.
Her assent? She's 9. She won't understand, and even if she does, it'll traumatize her.
We fully appreciate how completely overwhelming this is right now. Really, we do. But the truth is that the evolving thinking among medical ethicists is that children should be afforded gender autonomy, regardless of their age.
You know what? I just want to be with my daughter right now.
Of course.
Hey. You feeling better, Emma?
My mommy said I'll need an operation.
Yes, that's what my friend Dr. Charles and I came to talk to you about.
Hi, Emma.
So you remember when I took a picture of your belly earlier? Well, it showed me that you have something inside of you.
Something that only boys have, honey, not girls.
That part inside of you, it may cause you to change a little on the outside in a few years.
It'll make you look like a boy.
Miss Paulson, would you mind giving us a moment to explain, please?
So, Emma, most people who look like girls on the outside feel like girls on the inside. But sometimes a person who looks like a girl on the outside feels like a boy on the inside. And you know what?
Okay, stop. You're just confusing her. Of course Emma feels like a girl. Sweetie, the part inside of you, it's what's hurting you right now. So Mommy wants the doctors to take it out so that you'll be safe.
Mrs. Paulson?
Wait, will it hurt?
No, not at all, sweetie. You'll be asleep the whole time. And when you wake up, we can get chocolate sundaes. So it's okay if they take them out?
Mm-hmm.
Miss Paulson, can we speak to you outside for a moment?
Okay, you heard her. You have her assent. Take them out.
It was not an informed decision.
Well, Emma's 9 years old. She didn't understand half of what you were saying.
Again, regardless of her age, it's very important that we at least try and explain the situation to Emma so we can give her a chance to tell us how she feels.
I know how she feels. I know my child, and I won't let you manipulate her.
We were not trying to manipulate her.
Why don't we take a beat? Let Dr. Manning and I put our heads together and see if we can come up with a course of action that everybody's comfortable with. Okay?
Take it things didn't go well.
Emma's mom coerced her into having her testes removed.
Yeah, we gotta get Goodwood involved to see if we can convene an emergency ethics panel.
We have 3 hours tops until the testicle dies.
We better move fast.
Any word from the ethics committee? No way. No way they're gonna allow this.
Because technically they have both Judy and Emma's consent, and because testicular torsion is a medical emergency, the hospital feels obligated to act.
But the assent was coerced.
You know, coercion's very difficult to prove. And the truth is that in a majority of these cases, the courts do side with the parents. The board's worried about a negligence suit.
What? Oh, no. Oh.
Help! Someone help!
What's wrong with her?
The testicle must be more ischemic, not getting enough blood flow. We can't wait any longer. Prep this patient for surgery now.
Mommy, I'm scared. I don't want them to hurt me.
No, honey. They won't hurt you, I promise.
Judy, I know you love your daughter, and I know you're afraid of what the future might hold, but Emma trusts you. She counts on you.
I don't want anything to happen to my little girl. She's all that I have.
You're not gonna lose her. And no matter what gender Emma identifies with, she's still gonna be your child. The same kid who loves chocolate sundaes and hates ballet.
She told you?
That's the exciting part. Having our kids show us who they are in their own time.
Mommy. Mommy.
Don't check them out.
You sure?
Yes, I'm sure.
I was doing the laundry, and the next thing I know, I started cramping.
Are these contractions? I'm only 22 weeks.
Okay, let's get a CBC and UA with culture. Is there anyone we should call?
My husband's away at a legal conference, but he was having trouble catching a flight out of Buffalo. Is everything okay with my baby?
Let's take a look, okay? There's the heartbeat. Head circumference measuring at about 178 millimeters. Looks like a normal, healthy 22-week-old fetus to me.
Thank God.
All right, so we'll run those tests and go from there, okay? And don't worry, Shannon, we're gonna take really good care of you and your baby. Okay? Thank you.
Shannon? How are you feeling?
All better now.
I'm so sorry I wasn't here sooner. I canceled all my meetings, got on my first flight out. How's the baby?
Dr. Manning was just explaining. Hi. Well, I think it's just a case of Braxton Hicks contractions, practice contractions. Nothing to be concerned about. However, I would like to just run one more test just to ensure that it's not preterm labor. If that's all clear, then you should be good to go.
What a relief. Man, is it me or is it hot in here?
Mr. Kim, everything okay?
Throat's just a little dry. Is there any way I can get some water?
Definitely. Your color is a bit off. Have you had any fever, headaches?
I'm probably just worn down from the travel.
Well, how about I give you a quick look-see, run a few tests?
But Shannon...
Oh, go ahead, honey. You do look a little pale.
I'll have you back in no time.
Honey, I won't be far.
Right this way.
Thanks.
First time dads.
You said you travel a lot, so I thought of West Nile virus. I ran a mosquito panel. Good news is you don't have West Nile. Here's the thing. You did test inconclusive for Zika.
Really? Zika? How?
I'm wondering that myself. I mean, there hasn't been a case of Zika reported north of the Mason-Dixon line. Have you visited anywhere else recently? Maybe somewhere tropical? There have been a few cases reported in South Florida.
No, I haven't been to Florida.
Okay, well, regardless, the first thing we have to do is test Shannon.
Shannon, why?
Well, since Zika can be sexually transmitted, Shannon could contract it, leaving the fetus at risk of developing microcephaly. It's a devastating birth defect where the baby's brain doesn't form properly.
But we haven't had sex in a week. I've been out of town.
And you couldn't have gotten Zika in Buffalo. So you must have picked it up before that. It's important we test her.
I don't want to scare her needlessly. Besides, I'm feeling much better. Probably just had a touch of the flu.
Mr. Kim.
I really need to get back to Shannon.
I'm sorry, am I missing something here?
Okay. I wasn't in Buffalo. I was in Aruba with a lady friend.
Look, I'm not concerned with your personal life. I only care about my patient, and in this situation, we have to consider your wife.
No, she does not find out about this. I'm not risking my marriage over an inconclusive test.
I don't think you understand. Your baby's at risk. Shannon needs to know.
Dr. Halstead, they teach you about doctor-patient confidentiality in med school? Because they definitely covered it in law school. I'm your patient too now, and I'm telling you to keep your mouth shut.
Hey.
Hey.
How's Shannon's husband?
Bruce Kim? Turns out he wasn't in Buffalo. He was in Aruba with another woman. Tested inconclusive for Zika.
What? Well, we have to test Shannon.
We can't. Not without violating his confidentiality. He refuses to tell her.
That's ridiculous. I mean, if he was HIV positive, we could break confidentiality. Doesn't Zika get the same exemption?
No. Unfortunately, Zika's so new, there's no legal precedent.
But what if they have sex? What if he infects the fetus? I mean, you've seen babies with microcephaly.
Natalie, I have spent the last hour trying to find a way around HIPAA. I've got nothing. He'll come after the hospital. And my license, incidentally.
So you're just giving up?
There's nothing we can do. We can't justify breaking the law over an inconclusive test result. I know what you're thinking. Don't do anything.
Okay. Let's go. Oh, these flowers are so beautiful. Thank you for everything, Dr. Manning.
These brought me these. Aren't they pretty?
Before you go, there's just one more thing.
What?
Since you're approaching your delivery date, I think it's really important that you be cautious with physical activity. Try not to lift anything heavy, limit your stress, and avoid sexual contact.
Why? None of the books say anything about avoiding sex.
We're done here.
I'm sorry. I think there's something you should know.
Mr. Kim, this is Dr. Ellen Hart, Epidemic Intelligence Service Officer for the CDC.
May I speak to you in private, Mr. Kim?
No, you can't. My wife and I are on our way out.
I'm sorry, but federal law requires that I speak to you about your test.
What's going on?
Dr. Hart will fill you in.
Why don't we step in here, please? What did you do?
I made some calls. Since Zika is a public health emergency, the CDC has to investigate all inconclusive test results.
I'm impressed.
Natalie, back there, were you gonna...
Let's just say it is a good thing you showed up when you did.
Stand back. What was his temp?
102.
He's junky and wheezy on both sides.
Zach's been coughing, gasping.
It's terrible. Bibacillar infiltrates.
What does that mean?
Most likely pneumonia. April, let's start vancomycin, 40 milligrams per kilogram, and we'll get him admitted to the PICU.
Oh, God. Don't worry. We've got great pediatricians.
Now you can go up with him.
ED? Yeah. Dr. Halstead. It's the PICU.
This is Dr. Halstead. Yeah, that's right. Zach Womack, 4 months old. Really? Okay, thank you. That baby we just sent up to the PICU, he never made it there.
When we got off the elevator, a nurse met us, and she said that Zach needed some sort of test.
A scan. She said he needed a scan.
She took him away, and she never brought him back.
Did you follow up with radiology?
No scans were ordered.
And the nurse they've described doesn't match anyone on my staff.
Has someone kidnapped our baby?
We can't be sure about that yet.
Oh, no.
Call a code pink, tell security to put the hospital on lockdown. The ED, including trauma, goes on bypass. Until further notice, no one comes in or out. I promise you, we're going to find your baby.
Earl, the hospital's going on lockdown. Get to your post.
Yes, sir.
This is Code Pink. Code Pink.
Copy that, Code Pink. Get that patient in now. Hospital's going on lockdown.
We reviewed all the security cam footage. No one left the hospital with the infant.
So he and his abductor are still on the premises?
We think so. We'd have gotten a ping from the baby's ID bracelet if the abductor had tried to exit with him.
Dr. Charles, from your experience, what kind of person do you think we're looking for?
In a majority of these cases, the abductor is a woman of childbearing age who is either infertile or has experienced fetal loss. They're distraught and determined one way or the other to have a baby of their own.
Then maybe she's not likely to hurt him.
Not if wanting a child is what's driving her.
But what if that's not what's driving her? What if she's someone who enjoys causing others pain, a person without a conscience? I mean, it's possible, and if someone like that gets backed into a corner, there's no telling how she might react.
This person knew where the PICU was. Could very well have been a patient here. I think we should compile a list of women who have experienced birth trauma here in the last 6 months?
All right. And I think it's a good idea for you to assign a psychiatrist to each search team, help diffuse any situation where the baby may be at risk.
Let's get started.
Daniel, we've got to find this baby.
Surgical suites 1 and 3 aren't in use. You check those, we'll cover the rest.
Code pink. Code pink. All hospital personnel, please report to your designated stations.
Clear.
So, your description of our attacker as someone possibly without a conscience, I'm just curious, what led you to that?
There have been a number of cases of women murdering children. Diane Downs, Susan Smith.
I don't really see the comparison, though. I mean, neither of those women abducted a baby from a hospital.
You're just speculating, too. We don't know who we're dealing with. There's no guarantee she's some bereft mother who's lost a child. For all we know, she could be
A psychopath?
Dr. Charles, this has nothing to do with my father. And just because my opinion is different from yours doesn't make it biased.
All clear. Cole here.
We just got a ping off the baby's ID bracelet.
She used an emergency exit stairwell, east wing.
Wait. Zachary Womack.
They were here?
She cut off his bracelet. She knew the signal would bring us here. She's playing a game with us.
His IV. He's not getting his antibiotics anymore.
I have some news. Security compiled a list of former patients who fit the profile of our abductor, then cross-referenced them against today's visitor's log. Turns out we got a hit. Joanna Harris. You show them the tape, please. A couple of months ago, Joanna Harris was in the ED, pregnant. She lost the baby. 22 weeks. Very sad case.
So she impersonated a healthcare worker to get to the PQ.
It's entirely possible that the trauma, coupled with the overwhelming fear of never being able to carry a baby to term, pushed her over the edge.
But she seems to have thought things out pretty thoroughly. I'd say her actions were calculated, even predatory.
Well, given what we know about the patient, can you think of where she might have gone?
Someplace she could hide, a supply closet or call room.
Security teams covered all those.
According to the logs, Miss Harris took our maternity tour last May.
Meaning?
Well, isn't that when we were transitioning between the old maternity wing and the new one?
Yes. She might know the old maternity wing.
All right, let's go.
Hi, Joanna. I'm Dr. Charles.
Stay away. You're not taking him.
You know, the problem is the baby is very sick.
You can't have him. He's mine.
And I'm sure you want the best for him, right?
He needs medicine, antibiotics, or else he won't get better.
The fact is, if the baby doesn't get some treatment soon, there's a chance he could die.
No.
None of us want that. That's why we're here.
We need to get him back to his room so he can get treated.
Will you let us help him?
I'm afraid. There's nothing to be afraid of. We understand why you did this. No one is going to punish you. What about them? They just want to make sure that the baby stays safe. Nothing bad is going to happen to you, I promise.
Well, the important thing here is that we need to get some treatment for the baby as soon as possible.
You mean the baby, Joanna? I can't. You can. You can. Trust me. I'll protect you. What? No. Why? I can't.
gave you the baby. You lied to me. You lied to me. Why did you lie to me?
Hey.
Hey. Kevin Parks. He's 10 years old. He woke up with 8 out of 10 abdominal pain and a fever of 103.
We gave him Tylenol and a cool bath, but nothing's worked.
Okay. All right, Kevin, let's get you up on the bed.
Ow! That hurts.
That hurts? All right.
All right, you got it.
We're gonna figure out why.
There you go. Hi, Kevin. I'm Dr. Manning. This is Dr. Halstead. Can you show us where it hurts?
Right here.
Right there? Okay. Has anything like this ever happened before?
No, never.
Abdomen is tender but not rigid with no rebound.
Bowel sounds are decreased. I don't like it. It could still be his appendix, Crohn's disease, ulcerative colitis.
Temps up to 104.
Give ibuprofen and start cooling measures.
Is there any other medical history we should be aware of?
Yes. He's been diagnosed with pandas. Pandas?
Pediatric autoimmune neuropsychiatric disorder associated with streptococcal infection.
Kevin started getting tics and OCD after a strep infection 2 years ago. Nobody else could figure out what it was until finally Dr. Kravitz diagnosed him.
Okay, we'll be sure to give him a call.
I've heard of Dr. Kravitz. He sees a lot of kids with pandas, right?
He's one of the nation's top experts.
I'm guessing Dr. Kravitz put Kevin on long-term prophylactic antibiotics to fight the residual strep.
Yes, he did.
CBC, chem panel, blood cultures, abdominal CT, and hangogram of Vancostat.
We're gonna start him on some medication while we run some tests to try to figure out what's going on, okay? We'll be back to check on him shortly.
Thank you.
Hey, you've heard of this Dr. Kravitz? He labels every kid's neurological condition as pandas. It's not even an officially recognized diagnosis.
Either way, right now, that child is in real pain with a real fever.
Right, because he's been on 3 different antibiotics for over 12 months, which we both know has wiped out all the healthy flora in his gut, causing a massive superinfection. And all because his parents shopped around for a doctor willing to blame Kevin's neurologic tics on strep. Instead of admitting, they most likely passed it on to him genetically.
Okay, but dismissing them isn't gonna help. They are upset and worried.
And what they're doing to try and fix him might wind up killing him.
So Kevin's scans indicate toxic megacolon. It's a dangerous intestinal infection caused by an overgrowth of opportunistic bacteria.
Which is most likely due to his long-term antibiotic use.
So the new medicine you're giving him should fix it?
It's not that simple. Kevin's bowel is so inflamed, it's become dangerously dilated.
And if it perforates, it's a life-threatening situation, which is why we need to release the pressure from his colon to try and prevent that.
We appreciate your help, but we've spoken with Dr. Kravitz, and he wants Kevin transferred over there.
Dr. Kravitz says if we treat him incorrectly, it's only going to make Kevin's neurologic symptoms worse. He wants to give him an infusion of IVIG to prevent that.
Kevin's tics are the least of his problems right now. We need to focus on treating his infection.
We want that too, but Kevin's tics are a big problem. They're odd, and the kids at school are starting to stare at him.
Just don't want to do anything to compromise his future.
I understand, but...
We'll do the IVIG here.
Natalie.
That would work.
Great. We'll get started right away.
Thank you so much.
Why are you indulging them like this?
Indulging?
You know full well that IVIG will have exactly 0 therapeutic benefit.
It's keeping Kevin in the hospital. Why are you being so negative?
I'm just being realistic. The more you humor them, the less likely they'll ever be to seek out an actual effective therapy for what is most likely a genetic neurologic condition.
So what do you want me to do, Will? Have them sign out and leave?
No, you should just give them a placebo, IVIG.
If that's what's going to allow us to do our job, then that's exactly what I'm going to do. All finished. You okay, Kevin?
Have a word? Kevin's latest scans show increasing edema across the wall of his bowel, indicating lack of blood flow. At this point, we need to consider surgical resection.
Surgery?
Shouldn't we finish the IVIG first to see if it helps?
He can keep getting it, but we really need to move him upstairs.
We need to call Dr. Kravitz.
Mr. and Mrs. Parks, your son is running out of time.
My wife works tirelessly to try to fix our son's problems, and if she has any hesitation at all, then we need to listen to her.
How about I call Dr. Kravitz and explain the situation to him, okay?
Could you do that?
Of course.
Is there a bathroom nearby?
Right down the hall. Mrs. Parks. Sorry, it's just finishing up. Are you all right?
I'm just stressed.
Does that help?
What?
The hand washing.
It used to. In high school. But I stopped for a long time till Kevin got sick.
Having a child with uncontrollable tics must be so stressful.
That's why we've seen so many doctors. My husband likes answers.
Does he know about this?
He's already got enough that he didn't sign up for. What would be the point?
It might help you and Kevin.
I don't see how.
Kathy, you have OCD, like Kevin, and it's not caused by any bacterial infection, it's genetic. Something a child inherits from the parents.
I appreciate your concern, but please, just take care of Kevin's intestines. I'll worry about the rest.
His abdomen's more distended and his pain is getting worse.
Like I was saying, we need to take him up to surgery.
Dale, maybe we should let them.
Are you sure that that's necessary? Did you even talk to Dr. Kravitz? He says that general anesthesia will exacerbate Kevin's pandas.
You're not hearing me. At the moment, that is not our biggest concern.
But Dr. Kravitz
Forget
says...
about Dr. Kravitz. Kevin doesn't have pandas. His tics are from me.
What are you talking about?
He has OCD. It's not from strep, it's genetic. He inherited it from me.
It's a far more likely explanation.
So the antibiotics, all of it.
He never needed them.
It's my fault. All my fault.
Why didn't you tell me you had OCD?
I thought you knew something was wrong with me, you wouldn't love me.
Do the surgery.
Dale, wait.
We'll get Kevin ready to go upstairs.
It's a monster! Kill it!
Baby's temp is 94. I need more blankets.
Versad's in!
I start an IV, get 2 units of Bonig on the rapid transfuser, start the MTP.
Vitals at 86. Turn the O2 up to 10 liters.
I got the placenta.
Heart rate's down. Pressure stable.
Baby's starting to pink up.
Hey. Hey, listen to me. You just had a baby. That's your baby.
Baby?
Call Child and Family Services. No way she's taking this baby home.
Dr. Manning.
What's going on?
He's inconsolable. I've tried rocking him, swaddling him, singing. Nothing I do calms him down. Heart rate's in the 190s. O2 sats have been dropping.
Has he been feeding?
No, nothing. Is it possible he's still in shock from the cold?
I don't think so.
I'll go see if his labs are back.
That won't be necessary. He's addicted to heroin. And he's going through withdrawal.
I heard about the baby. Neonatal abstinence syndrome. That's a rough road.
Yeah, I'm giving him fluids, Ativan, and aspiration precautions, but his numbers aren't getting any better. How's the mom?
Just wants to get out and get her next fix. Why?
Studies show that babies who are not thriving actually do significantly better when they have physical contact with their biological mothers.
So?
So I think we should have Leanne hold him for a little bit.
You can't be serious. She'd try to kill him.
She would be supervised. Even hearing the mother's heartbeat can lower cortisol levels and stress.
Leanne had 9 months to do right by her baby. She lost that chance.
Dr. Charles.
Well, I appreciate your concern for your patient, Dr. Manning, but I'm also concerned for mine. I mean, here's the problem. That baby's going home with somebody else. We let Leanne bond with him and then just rip him away. Any chance we have of helping her, we're pretty much going for good.
Dr. Charles, we're talking about an infant's life.
I'm aware of that, but I just think that we should take a beat and look at all sides of this.
Excuse me, Dr. Manning. DCFS is on their way. They've got some foster parents that might be interested in caring for your patient.
Ms. Crawford,
I told you I don't want to talk.
I'm not here to discuss detox. I want to talk to you about your baby.
What about it?
He's a boy, and he's withdrawing from heroin. He's not eating, not sleeping. Breathing and heartbeat aren't quite as regular as we'd like.
So give him some medicine.
Well, we have been, but it's not quite that simple.
Okay. So?
Leon, adults have years to develop the coping mechanisms that help us get through life's trouble spots. A newborn doesn't have any. For him, his mother is the only thing in the world that makes him feel safe. Being held by her, feeling her skin.
You want me to hold him?
Well, it might be the best medicine we've got.
I don't know how to hold a baby.
Well, we can show you. We can teach you how to do that.
But this baby's sick because of me, right? There's no way that more of me is gonna help it.
Well,
Listen. Please leave me alone.
How are you feeling?
Fine. You don't think I should go see my baby, do you?
That's up to you.
They say he's sick.
Yeah, he is.
I never planned on getting pregnant. You know. Whatever. You think I'm terrible.
I just wish things had worked out differently for you and your baby.
Yeah. But I guess where you're from, things work out great for everybody. Why would you understand?
Actually, I understand a lot better than you think.
Dr. Manning. What's happening?
He's having a seizure.
Give him a bolus of Ativan. O2 sats are down to 72. He can't get any air.
Bolus is in.
He could suffer an anoxic brain injury. Give him 0.1 milligrams of morphine.
That's down to 67.
He can't go much longer. Give him another 0.1.
That's back to 77. 81.
He's breathing. Get a pediatric intubation kit. If this happens again, we're gonna have to put him on a vent.
And he's gonna die.
He could. Yeah,
And you really think that having me hold him is gonna help?
I know it's a lot to ask, and I just wouldn't be doing it if the situation wasn't so dire. But you're his mother, and the baby needs you. And if there's any chance at all that you're holding him might help him get better, you think we should try?
This is my fault. I did this to him. Okay.
Okay.
He's so small. Hold him close now. Against your skin.
Hi, don't cry. Yeah. Yeah.
Right there.
Oh, excuse me. Can I just have a quick word with Miss Crawford first?
Okay. Hey.
Oh, wow. He looks great. A lot better, huh?
He is great.
So, they have finally made some room for him in the intensive care unit. So we're gonna take him up there now.
Okay. Oh, do I carry him up or do we take him up in the warmer?
Well, actually, Leanne, there's a foster couple up there who's gonna be looking after him from here on out.
Boy, he likes me so much.
I know.
And he is doing so well. So I should just keep holding him.
I really wish you could. Really, I do.
But you said that he needs me.
I know I did. I know how difficult this is. I really do.
I'm sorry, but we need to take the baby now.
No. I'm his mother. I'm his mother. Wait, Dr. Charles, please.
Sorry.
You know. Dr. Charles, please, can you help me? Please, can you help me? Just explain to that it's my baby. Dr. Charles, please, can you just... Dr. Charles, can you...
Talk to me, Chow.
Julia Dutra, 34, pregnant, power 1, gravida 0, fainted in a yoga class. An AFib at 150, BP 90/60.
Hi, Julia. I'm Dr. Manning. This is Dr. Halstead.
I told him I don't want to be here.
Hopefully this won't take long. On my count. 1, 2, 3.
Julie, are you okay?
I'm fine. Just call Mira.
Our midwife. I think Julie would be more comfortable at home with her.
Sir, your wife's in a dangerous arrhythmia. We can't let her go until we get under control.
Do you have any history of heart disease?
No, I don't eat red meat, and I keep a high antioxidant profile to minimize inflammation.
Okay, good. Let's get an EKG, cardiac lab, CBC, CMP, coags in a UA, and let's start 5 of Rapamil IV, okay?
No medications.
This one's safe for pregnancy.
If we don't control your arrhythmia, it could put the baby in danger.
Is that true?
Scott.
What? We don't want anything bad to happen.
Okay, fine, but then we're leaving.
Thank you. All right, let me ask you a few more questions.
Wait, what are you doing?
Just a quick fetal ultrasound.
No, get that thing off me.
Acoustic radiation impairs neurodevelopment.
That's not actually true. Note that the fetus measures normal size and weight for 5 months.
Wait, what did you say?
That this looks like a normal 5-month pregnancy.
Measure it again.
I'm sure of the numbers.
Well, you're wrong. Measure it again.
See? Totally normal for 5 months.
Except I'm not 5 months pregnant. I'm 8.
Julie's labs.
Anemia, vitamin deficiencies, all the signs of early kidney failure.
And no family history of troubled pregnancies or genetic conditions.
Maybe a malabsorption syndrome?
Miss Dutra, have you ever had any gastrointestinal issues, Crohn's, ulcerative colitis?
I used to have leaky gut. At first, we thought it was just lactose, but of course, it was more complicated than that.
Okay.
I see. And were you seeing someone for this?
My nutritionist, she got me off lecithin and phytic acid. It helped some, but then once I got pregnant, I had to give up all GMOs and anything that wasn't locally sourced, too.
So what do you eat?
Certain strains of Swiss chard, broccoli. Sometimes I'll have a cup of adzuki beans.
But she supplements a lot. Selenium, coenzyme Q.
You eat 3 meals a day? More? Less?
I do portion control to manage the baby's glucose. 700 to 800 calories a day. Why?
We suspect the difficulties with this pregnancy are being caused by your diet.
That can't be. I only eat organic.
But you're not getting enough protein or iron.
And we're seeing the effects it's having on your baby. We need to start aggressive IV nutrition to help it grow as much as possible before you deliver. If we admit you to obstetrics now, I understand that you don't want to be here, but at this point,
you're not giving me IV food.
Your baby is severely malnourished.
No, my baby is getting healthy farm-to-table nutrients. You're not gonna pump him full of toxins and chemicals.
Miss Dutra.
I said no.
Your arrhythmia hasn't resolved yet. We'll be back in a minute to check on you.
She's starving that baby to death.
We need to talk to Goodwin.
Yeah, your heart isn't responding to the meds. If things keep going in this direction, we may need to consider an emergency C-section to take the extra load off your heart.
Drug me up and cut me open? No way.
That's not what we want either, but we do need to protect you and your baby. That's why in the meantime, if you allow us to give you some IV nutrition—
No way. Those bags off-gas PPAs? Look, you don't get it. This baby is being formed from every single molecule that enters my body. It is my job to keep it absolutely pure. That is how I'm protecting it.
They understand
No,
that.
they don't.
Excuse us. Please tell me you have some good news.
I'm afraid not. The committee ruled that we can't intervene against her wishes, not even for the sake of the baby.
So that's it. We just have to watch as she lets the baby die.
If that's what she chooses to do.
But that's not what she wants. She wants to help her baby. She's just confused about how to do it.
I'm sorry. Our hands are tied.
Mr. Dutra? Hi. I need you to talk to your wife.
She won't listen to me.
But you do understand this has gotten out of hand.
Of course I do. I mean, all she thinks about is how uric acid and compromised soil are infecting everything we eat. What do I say to that?
How did you handle it in the past?
Wasn't this bad before. I mean, she's always struggled with anxiety and control issues. But when she got pregnant, it's like she turned the dial straight to 11. Nothing's pure enough anymore. Everything looks like baby poison.
But there has to be something you can say to get her to let us help.
I am so scared my wife and my baby are gonna die. Can't you do something?
What the hell are you trying to do to me?
Please, Miss Dutra, let me
I told you no food.
Just 1 second.
What's going
I need
on?
you to calm down, okay?
She
Please.
put this in my IV behind my back.
Miss Dutra, wait.
Glucose, amino acids. You did this?
First place.
Miss Dutra, Miss Dutra, please.
Dutra, just relax.
Miss Dutra, we need to get you back into bed.
Get her away from me. Get her away from me.
I need some help here. All right, easy. Relax, I have her. Just get her back up.
You're very lucky her husband convinced her not to pursue action against you or the hospital.
Miss Goodwin, I'm sorry.
I expect better from you, Dr. Manning.
Nat, wait.
I'm sorry.
I'm really not interested.
I understand. If you didn't trust us before, you certainly have no reason to trust us now.
Then we finally agree on something.
Julie, fearing for your baby's safety is the most natural thing in the world. When I was pregnant, I lost my husband. I was afraid of a lot of things. And then one day, after I had my son, I was up in a high-rise building on the balcony and suddenly had this vivid image of myself falling over the railing. And my first thought was what would happen to my son if I wasn't here for him. And the craziest part is my favorite thing in the world had always been Ferris wheels and roller coasters and being up in the air. But from that day on, I had this totally irrational fear of heights.
It is really scary being solely responsible for that tiny, defenseless person inside of you. But you are letting your fear win. And it's gonna end badly. Anyway, I am sorry.
Dr. Halstead.
Her heart rate's too high and her pressure's dropping.
Baby's heart rate's down to 90.
It just hurts.
Your arrhythmia is escalating out of control. Push 10 milligrams of diltiazem stat and upper O2 to 6 liters.
We need to do a C-section. We have to get the baby out.
No.
Julie, I know you don't trust me, but your baby is in real danger.
84?
Julie, let them do it.
I can't.
Julie, if you don't let us do this, your baby is going to die.
You can't do it.
Thank you. Call Abby and tell him we're coming up for a crash C-section now.
You heard her. Let's move.
How are you feeling? I'm okay. What are they putting in him? Proteins, carbohydrates, fats. He needs them to grow.
Dr. Halstead, Doris, you're with me. Copy that. Barry?
Alex Mayer, 23 slash and stab, large diagonal laceration to the abdomen. He's a little tacky. GCS 15. Get it out!
You're going back, Dad.
Get it out!
Wait, weapon still in him?
I don't know. Wasn't even a call. We were 2 blocks away, so I'm on the street bleeding. Loaded him in the ambo and rolled. I can feel it inside
Whoa, whoa, Alex, keep your hands down.
I got you, Dr. Halstead. Let's transfer.
On my count. 1, 2, 3. 2% to calm him down. Thank you, boys. How's that percent coming?
On it, doctor.
Gaping diagonal incision for the right upper quad.
Evidence of evisceration?
No, I can see the base. Abdomen is still intact. Just a flesh wound. It's really clean, though.
Wash it out and stitch it up.
Irrigation?
Sir, you're a lucky man. Whoever knifed you didn't do any serious damage.
Look at this. Betadine smeared all over the abdomen. The skin was prepped before the cut. I'm telling you, that incision is precise.
Back alley surgery gone wrong?
Alex, what happened?
I was desperate.
Dr. Halstead, hand under the blood.
More betadine.
So he doused his own hands.
Alex, did you cut into yourself?
I had to get it out.
Get what out?
The person living inside me.
Why don't you believe me? I'm not crazy. Something lives inside of me right here. I hear you. I understand.
To get it out! I feel it all the time.
Alex, we're gonna help you. I promise. Sedative?
No, wait. I'm sorry. I'm telling you the truth. I can feel it inside of me. Please. Please.
What'd you give him?
5 Versed.
2 probably would have sufficed.
He put hands on you. I was being cautious.
So what are you thinking?
Schizophrenia.
You know, that was my initial thought, but now I'm not so sure.
Seriously? That's paranoia that there's something living inside him, and his attempt to remove it is literally a textbook definition of a somatic delusional disorder.
I'm stuck on the level of premeditation. You know, sterilization with betadine, the clean incision, doing it near a hospital. Well, that kind of forethought, it's just not consistent with schizophrenic psychosis.
So he's a germaphobe with a steady hand. It doesn't mean he's not schizophrenic.
Could be true, too.
So, start him on antipsychotics and reassess when his mind's clear?
I'm just not there yet. My gut tells me it's chemical, like maybe a methamphetamine overdose. Before we go any further, let's run a tox screen, see if he's just high.
Alex's tox screen is negative for methamphetamine, negative for all drugs. In fact, he's clean.
Yeah, I saw the report.
So now can we start him on a course of antipsychotics?
Just still not convinced it's schizophrenia.
How? He's presented with more than enough evidence of a thought disorder to warrant the diagnosis.
Yeah, even so before today, I mean, his medical record is clean. The history doesn't track with schizophrenia.
Or meth addiction. He doesn't fit the profile of a user either.
Yeah, just because he's clean today doesn't mean he's free of the drug.
So that's what the fan is for? White noise? Dr. Charles, really?
Yes, really. White noise has been proven to trigger auditory hallucinations in meth users.
How long have you been waiting for something to happen?
7 or 8 minutes,
How long does it usually take?
2 or 3. Probably not meth. Go ahead, start antipsychotics.
2 of Haldol. Dr. Charles?
Oh my God.
Alex, get his hand, get his hand!
I need a car.
Come to
This
his
is
ear.
the
Oh
only
my
way.
Help! I need some help in here!
What happened? He used a pen to pop the stitches, chisel through his abdominal wall.
Clearly.
All right, no time to repack. Got to scoop and move. Saline?
Okay, call OR. Tell them we're coming immediately.
How's he doing?
A few more feet to go, but no perforations to the bowel.
I was just standing there. Meanwhile, he's ripping himself open with a pen. And the extrovert said it completely tricked him out.
But if I hadn't given it to him, who knows? I mean, Alex was intent on harming himself. He could have attacked one of us.
What the hell? There's something embedded deep in his left gutter, next to the colon.
What is it?
I have no idea.
Wow. I guess there was something living inside of Alex.
Still not exactly sure what I'm looking at. Is it a tumor?
Possibly. Or it could be a fetus in fetu, a twin that he absorbed in utero. Either way, it's not a result of schizophrenia or meth.
How about that?
It's gotta be so rare.
To say the least. It's very cool.
How did he know not only that there was something inside him, but exactly where it was?
Beats me. I mean, after all the advances we made, splicing the genome, reprogramming viruses, mapping the brain. In this case, you know, just completely trumped by human instinct.
Everything I've learned about human nature, I still can't see things coming.
He scared you?
There's risk in our work.
I guess I realized a long time ago you choose to see the threat or the opportunity.
Please! My daughter needs help! Can you help us? Please! I don't know what's wrong with her.
I'm not gonna hurt you, okay? Take it easy. I'm not gonna hurt you.
I'm Dr. Charles. Can you tell me what happened to your daughter?
She's my crazy ex-wife. She's been unbalanced before, but...
Where's my daughter? Ma'am, you can't... Catherine!
You were keeping her prisoner. Are you insane?
You had no right to kidnap her. My daughter needs to be discharged immediately.
I'm afraid we can't do that.
It's nothing you can help her with. I need to get her home now.
You're torturing her.
No, I am not the one who is harming her.
Who is? Who is harming her?
The demon we've been trying to exorcise.
The mom rat! Mom rat!
You see, my daughter is possessed. She's possessed.
So, Miss Campbell, when did your daughter start having these symptoms?
About 9 months ago.
And was she experiencing any emotional stress at the time?
I'm sorry, why are you speaking to her as if she's a rational person?
First, please.
No. She had just made partner at her firm, was seeing a nice guy. Then out of nowhere, she began acting strangely. She couldn't leave the house, couldn't work. She couldn't take care of herself, and so I brought her home.
There are a couple of tests that I'd like to run.
There's no point. I have taken her to countless doctors, psychiatrists. They have run all the tests. No one can figure out what is wrong with her.
So exorcism is the answer.
It was starting to work. She was starting to come back. Look, I am not a religious person, but I have exhausted every other option. Catherine wets the bed. She speaks in tongues, shouts at empty rooms.
There is no such thing as demonic possession.
I am not interested in your opinion. I want her discharged immediately.
I think it's safe to say that your daughter is a potential threat to herself, and it would be my advice to commit her, at least temporarily, until we can figure out what's going on.
I have power of attorney over my daughter's medical care, and if you put her on a psychiatric hold, I will have my lawyer down
Miss
here.
Campbell, your daughter is severely dehydrated, malnourished. At least let us hang some IV fluids until we stabilize her.
As soon as she's rehydrated, I am taking her home.
Dr. Reese, could you please take Mr. Ferris to the consultation room? Thank you.
I love my daughter.
I am sure that you have her best interests at heart.
Thank you.
We are going to take care of Catherine as quickly as we possibly can. In the meantime, why don't you try and get yourself comfortable in the waiting room?
Thank you.
What are you thinking?
Well, the mom seems kind of rational. Last possession case I read about, the underlying issue was actually neurological. I think maybe we could sneak her in for a quick MRI, see if we can cross it off the list.
Yeah, I'll let radiology know she's coming.
Okay. It's very often emotional distress that triggers this kind of dissociative state.
What kind of emotional distress?
We were hoping you could tell us.
To be honest, we'd just begun to reestablish a relationship. I hadn't seen Kat much after I split with her mother 22 years ago.
Why not?
Well, it was a pretty ugly divorce. I mean, you've seen how unstable my ex-wife is. After we split, she poisoned my relationship with Kat. And that's really my biggest regret, is that I let Samantha push me out of my daughter's life. But once I reconnected with Kat, I swore to her that I would never let that happen again.
And when was that, you two reconnecting?
About a year ago, I reached out to her.
And what prompted that?
I had a heart attack, and it nearly killed me. And I swore that I needed to make up for lost time. So I would fly in once in a while, we'd go out to dinner, and then she moves back in with my ex-wife and then stops returning my calls, and then I get worried. And so I fly out here to see what's going on, and now it's all this.
What if Catherine's suffering from severe separation anxiety?
From her father?
She lost him once in the divorce. He has a heart attack. She almost loses him again.
Well, I mean, according to his version of events, I guess that's certainly possible.
I don't know where it leaves us, though. It's not like we can get someone in Catherine's state to open up.
Her sedation's worn off. She should be awake. Good luck.
Hi, I'm Dr. Charles. This is Dr. Reese. Could you tell me your name?
You're in the hospital. You're safe.
Is that your name?
Mom rat.
Take it easy. Take it easy. Little help, please. Push to a Versed.
Got it.
It's just gibberish.
Make some the moon breath. Make some moon breath.
Not so sure about that. So, believe it or not, there is, in fact, the case to be made that your daughter is possessed.
What?
Not by a malevolent demon, but, well, by her 6-year-old self.
6-year-old self? What do you mean?
We suspect that this could be the result of a trauma she experienced when she was a little girl.
I don't understand.
It's called dissociative repression.
Disagreeable memories or personality fragments are split off and then pushed down into the subconscious.
Yeah, in your daughter's case, this fragment has resurfaced and perhaps hijacked her entire persona.
How could you possibly know that's what's going on?
Well, aside from the bedwetting and the tantrums, the biggest clue is her language. It took me a while to realize this is not all gibberish. It's Lewis Carroll. It's a poem called Jabberwocky from Through the Looking Glass. Do either of you remember reading this to her when she was a child?
I didn't.
No, I don't think so.
No?
Wait. You did. When she was little, I remember.
Mr. Ferris, would you mind just reading a little bit of this?
Oh, this is ridiculous. Psychobabble. Look, my daughter's very ill. She's not a child. She's a demented adult.
Just humor me, please.
No, we need to take her to a real expert and not this quack.
Just read the damn book, Jerome.
No, I'm not going to do it. It's ridiculous.
In that case, will you allow me? 'Twas brillig, and the slithy toves did gyre and gimble in the wabe. All mimsy were the borogroves, and the momraths outgrabe.
No.
Stop it, you're upsetting her.
No.
Beware the Jabberwock, my son. The jaws that bite, the claws that catch.
No, please.
Stop this!
No! Please, don't!
Oh my God. I remember she'd be crying. She'd say it was the monster from the book, and I thought it was all in her head, but it was you.
Now see what you've done. I told you that she's unstable.
Oh, I always suspected you, but I didn't want to believe it. I couldn't believe it.
You're insane.
You touched her?
Oh.
You did things to her?
I've heard enough of this.
God.
I'm not listening to this anymore.
Oh, my poor baby. Oh, my God.
Dr. Reese.
How could you do that? A child, a little girl.
Leave me alone.
You destroyed her, you know
Dr.
that?
Reese, enough.
You are the demon, you!
Dr. Reese? You let this go, you hear me? He might be a monster. He's not the one who hurt you. He's not the one you want to be yelling at.
So when did your back start bothering you?
Oh, it's been killing me since last night. Listen, I probably overdid it in my spin class. I've been working on my stamina.
We're off to Italy tonight. My trip through Tuscany.
Mm-hmm.
Our 30th anniversary.
Congratulations.
Thanks. So let me know if you feel anything tender.
Okay.
Okay? The spinning, is that a new activity to prep for the trip?
Yeah. And also, I've been trying to lose the 20-ish pounds I gained over the winter. Obviously, it's not working. But muscle weighs more than fat, isn't that right?
Don't answer that.
Are you on any medications, Mrs. Davis?
Yeah, I'm on hormone replacement therapy. I'm at high risk for osteoporosis, so I started the hormones after menopause.
Okay.
No midline abnormalities?
Okay.
Do you have any burning with urination?
No. Although lately it does seem like I have to go every 10 minutes. My granddaughter just got out of diapers. I guess I'm on my way into them.
Well, looks like it's just a muscle strain.
Really?
Yeah, 10 of Flexeril and 800 of ibuprofen. And I'll check back in an hour, see how you're feeling.
Thanks.
Okay.
Muscle strain.
So the Zofran hasn't helped at all.
No, and the cramps are unbearable.
So is her gas.
Hey!
No fever, vitals are normal.
All right, let's hang another liter of normal saline in order of CBC, CMP, amylase, and lipase levels. Okay? This might be a stomach bug, possibly kidney stones, okay? I'm gonna press on your stomach.
Wait! I need a bathroom.
Okay.
Oh, okay.
I need a bathroom right now.
Come on, honey.
Okay, hold on a second.
We'll get you there.
Ah!
Oh!
What?
Whoa.
Sorry.
That's okay.
Honey, let's get you back into bed.
Oh my God, no! I still need to go.
Okay, I'm gonna help
really
you.
bad.
Wait, no. That's not urine.
Okay, let's get you right back into bed. Come on.
What's going on?
What's happening?
What's going on?
Oh! Ow! You. Ah! What are you doing?
What's
Oh.
going on?
Yikes!
What is going
Really?
on?
Are you? Whoa!
Oh. Okay, Miss Davis.
Yeah.
You're gonna want to push, but don't.
Oh, wait, no. This is not possible.
Oh, what is going on?
Your wife is pregnant and in labor.
No, that can't be true. I'm 55. I've been through menopause.
I know this might be a shock, but this is happening. I am positive. Page OB.
I'll be right back, okay?
Oh my God!
Oh my.
Yeah! Oh, this can't be real. This can't be real.
What the hell is OB?
Take 5 minutes.
We can't wait. The baby's crowning.
What?
Tessa.
Yeah.
On 3. Really big push, okay? All right. 1, 2, 3.
Yeah, good.
When did we go to Mark and Patty's cabin?
What?
Was that 4th of July?
What are you talking about?
Just trying to figure out when this happened.
Oh, God, Greg, how does that matter now?
Mr. Davis, can you please help the nurse hold your wife's leg down? Thank you.
Yeah.
Okay.
Tessa, look at me. Look at me, Tessa. Okay, Tessa. One more push, all right?
Okay.
You can do it. You can do it.
Yeah.
You can do it. Ready?
Yeah.
Go.
You're doing great. You're almost there. Okay.
This is crazy. Okay. It's a girl. Congratulations.
Congratulations to you both.
Goodness.
Oh, my gosh.
Okay. No, right. I understand. Okay, bye. I canceled our trip. They asked if I wanted to rebook for a later date. I said sure in about 18 years.
What's that saying? When we plan, God laughs.
Speaking of planning, we need diapers and a crib and a car seat and bottles and onesies and did I say diapers?
You did.
I ate sushi. I had the occasional glass of wine.
I am happy to report that you have a completely healthy baby girl.
Really? Oh,
Amazing.
yes.
Hello.
Oh,
God.
Oh, holy cow, you weren't kidding.
This is our son, Martin, and our daughter-in-law, Amy, and Haley. Come here and meet your, aunt.
How about that, huh?
We'll give you all some time.